What is the recovery like after a DaTscan? Have you ever wondered what happens after a DaTscan? This imaging procedure is crucial for diagnosing Parkinson's disease by examining dopamine transporters in the brain. The recovery process is generally quite simple and does not require extensive medical supervision. Let's break it down step by step. First, the entire procedure can take several hours. After receiving the radioactive tracer, there is a waiting period of 3 to 6 hours. This allows the tracer to distribute throughout your body. The actual imaging part lasts about 30 to 45 minutes. Now you might be curious about the radioactive exposure. The amount from a DaTscan is considered small. However, there are guidelines to follow to minimize exposure to others. For instance, if you are breastfeeding, it is recommended to interrupt breastfeeding and discard breast milk for at least 6 days after the procedure. Once the scan is complete, you can usually go back to your normal activities without any restrictions. The radioactive tracer will naturally exit your body over time, and you do not need any special treatment or medication to help with this process. As for side effects, they are rare and typically mild. Most patients find the procedure well tolerated, experiencing little to no discomfort or adverse reactions. The results from a DaTscan play a significant role in diagnosing conditions like Parkinson's disease. They help assess dopamine activity in the brain and can differentiate Parkinson's from other movement disorders, such as essential tremor. However, it is important to know that a DaTscan alone cannot diagnose Parkinson's disease. It is part of a broader diagnostic process that includes clinical evaluations and other tests. In summary, recovery after a DaTscan is generally straightforward. You can expect a short waiting period, minimal side effects, and the ability to resume normal activities right away. Always remember to consult with your healthcare provider for personalized advice and information tailored to your specific situation.